Hello, Hyderabad. I am Dr. Jayanthi, medical oncologist working at Kamineni Cancer Institute, Nagar, Hyderabad. Today, on the occasion of World Cancer Day, we would like to come up with a short awareness program regarding cancer for the general public. Every year, first Saturday of February is celebrated as a World Cancer Day, and this year's theme is to close the cancer gap. We all know that many people are dying because of cancer, and the cancer has now become a public health issue. We can save thousands of lives every year through equitable access to cancer prevention, early diagnosis, screening, treatment, and care. Cancer per se is increasing throughout the world, and there are more modalities of diagnosis, treatment coming up. But still, the healthcare gap is maximum evident among the wealthy nations and also low income nations. So, what can be done to decrease the cancer care gap? We all know that cancer affects all over the world, and almost 10 million people died in the year 2020 because of cancer. And the number we all should know that it is going to increase in the coming years. So it is high time that we get up from the slumber and try to close this care gap. The reality of today is that who you are and where you live would mean the difference between life and death, because healthcare accessibility and affordability is different among different people, different nations, and there are multiple factors which affect the accessibility of healthcare. And this is not fair because we need to change it to decrease the gap, and so that every possible effort is made that everyone is given equal opportunity for getting healthcare and also getting a good outcome. So understanding inequity is the first step. So we need to understand that there is a problem in delivering this healthcare. So inequity is everywhere. It's where in every walk of life. But obstacles are always made to overcome. There is always hope. The first step in recognizing this inequity is when you start to begin to challenge our own assumptions and biases. Come out of your biases, listen to the perspectives of people living with cancer, and fight to close these gaps once and for all. This inequity is inequity as same as inequality? No, these are two different issues. Inequality refers to uneven distribution of resources. Resources can always be provided, like healthcare, personnel, hospitals, money, and all. But inequity means it is unjust, avoidable differences in care and outcomes. This inequity is not just money related or healthcare personnel related. There are many other biases occurring because of this. So, what does an equitable world look like? An equitable, ideal world is where you will achieve health equity, where every person has the opportunity to reach his or her full health potential without barriers or limitations created by social position or other socially or commercially determined circumstances. This is a dream to come true, but still we can make this happen. The goal is simple. Health equity is now the important goal to be achieved. How can this happen? This can happen when you start educating the public to care about cancer prevention. We should not think that even the public also has to realize that it is not something the government provides. It is after all their health, and they have to take initiative. Even every individual is responsible for his own health, and they have every right to come and access the healthcare and get their due turn of events to be done. Equipping the healthcare professionals with skills and knowledge, including about how inequality influences cancer care. And the other thing is strengthening primary healthcare delivered in communities. We have a good primary healthcare system where the baseline root worker, like ASHA worker, usually inculcates health education among the family members, among the rural people, so that they go, because they are of no clue where to go, whom to approach. The rural urban divide is large among Indian population, and if we can bridge this gap by giving some referral system also, more people will be accessing the healthcare. We have to understand that providing more number of hospitals, providing more number of doctors, providing more supply of drugs is not going to improve your outcomes. It is the important duty of the individual or the patients to come and access this thing, and they also have to take health active participation. This cannot be imposed by the government, an initiative has to be taken by the active participation has to be taken by the public and also the patients. Addressing through policy and programs some of the social and economic factors that can negatively affect the people's health. This the government should always take up, and it is taking up. But we also have the same duty and responsibility to go ahead and seek the good deeds which are being coming out of this. Increasing the resources, meaning both money and people. As I said, dedicated cancer centers, research, and tracking the burden of cancer nationally to more effectively shape our investment. So, what is possible in Western world need not be best for us in an Indian context. So we have to think because our problem is local and we have to think locally to overcome our own problems. Implementing country specific cancer prevention and control plans that address each country's unique needs and resources is also an important point. Because in Western world people you do pap smear regularly, but Indian world getting pap smear for whole of the nation is practically impossible. That is the reason the new technique of visual inspection with acetic acid (VIA) has come up, where the ASHA worker usually does visual VIA is done, and high risk women are referred to higher centers to seek help. So I again like to stress that individual also has an important role. This role is by raising your voices and pressure the government to address the root causes for these inequalities and also to treat cancer as an important health issue. It has now become a public health issue, and we also have a national cancer control program and it is a part of the national non-communicable diseases control program. And also by challenging directly, vocally, unwaveringly the stigma and discrimination in all its forms. There are 8 barriers that stand in the way of cancer care. One is gender norms and discrimination. When we see in the routine people who come to seek help, so most of them it will be male, if you female, or if you have a child, usually they are neglected. They think that they are not important. So this gender bias is present among all walks of life. And there are also barriers for minority population. Some minority people might not be having access to get their investigations done. Poverty and socio-economic status does not need to be mentioned because this is applicable for any walk of life. Urban-rural divide. I said that rural people might not know where to go. Even they know, even if you provide n number of facilities, the patients do not come and access. We have not achieved the goal what we thought we do. Age again is a barrier. People think that people who are more than 70 or 80 years of age do not require any intervention to be done. So that barrier, that bias should come out of the people. So this, no one will help you to come out of this bias. People should individually understand and think about themselves. Barriers for health, for care of people with disabilities, and homophobia, transphobia, and related discrimination. This again is a big issue, uh, including the transgenders into the normal walk of life is itself is a big issue. When they come up with some health related issues, accessing healthcare again becomes a problem. We are still not open to that, but we should open up to accept them as a part of our social system. Refugee status and forced displacement. People who are forcibly displaced are refugees. They would not have any evidence of local Aadhaar card or address proof or anything. In that way, there is a bias in getting a healthcare this thing for them. So, how do we reduce the risk of cancer? The risk of cancer is some of them are unavoidable, but things which are there in our hands, at least we should make an attempt to get out of it. So, reduce your exposure to alcohol and avoid tobacco. These are the two things. No government is going to ban tobacco or alcohol. This is and everyone who take tobacco and alcohol know that it is harmful to them. But it is we who have to take a great decision to stop and avoid this, and also maintain a healthy weight uh, and diet. Reduce your outdoor exposure and indoor pollution. Engage in a regular physical activities almost 2 hours per week, means 30 minutes a day, 5 days a week is enough to keep your system moving. Avoid ultraviolet radiation. Get vaccinated against hepatitis B and HPV, which help you to prevent some of the preventable cancers. The risk factors which you look at them, which among this, I think tobacco and alcohol is in our hand, which we can stop. Physical inactivity is again our own issue. Unhealthy diet, we can do that. Air pollution, we cannot blame factories or anything. At least the things which are in our hand should be taken care of. And some chronic infections like H. pylori, HPV, and hepatitis B and C also increase the risk of cancer. But we have vaccines for HPV and hepatitis B, and we should go ahead and take these vaccines so that we can prevent at least virus related cancers. The progress is possible because 30 to 50% of all cancers are preventable. So preventable at least have to be vaccinated, and there is a lot which can be done. Adopting healthier behaviors can go a long way to reduce your cancer risk. I again say that progress is possible because it is an investment which you do in information, diagnostic, and treatments to improve our chance of surviving and also getting better from a cancer. So, what can we do to reduce your cancer risk? Is again, repeating again, choose healthy foods, which includes greens and vegetables and fruits, at least 3 to 4 servings a day. Move more. Stop sitting in a couch. Start being a couch potato. Quit smoking and also vaping. Cut down on your alcohol. Be sun smart and stay away from sunbeds. Avoid pollutants and chemicals, including asbestos, pesticides, and containing BPA. Get vaccinated against HPV and on HPV, and also know signs and symptoms when to approach a doctor. And one important thing is that without confirmation, unlike in other diseases, we do not go ahead and treat. So confirmation is a must for all cancers to be treated. So what can be done? What inaction can cost us? Because if you don't take an action now, you end up spending more. Good health drives productivity, social stability, and economic growth. And same way, in health and will lead to decreased economic growth and social instability. So the total global economic cost of cancer burden is almost 1.16 US dollars, 1.16 trillion US dollars. Saving lives is saving money. So a penny, as the saying goes, that a penny saved is a penny earned. So if you invest almost 11.4 billions in prevention strategies, you end up saving almost $100 billion in cancer treatment costs, because cancer is going to lead to loss in productivity, healthcare costs, loss household income. There is reduced quality of life, disability, and premature death. So half of the world's population lacks access to full range of essential health services. Why? This is because the differences are because of the income and education levels and also geographical location. Fortunately, India has all access to healthcare, both medical, radiation, and surgical oncologists, and also the investigative part. But there are many poorer countries which lack this thing, and discrimination. This they cannot fight against it. And any discrimination based on ethnicity, race, gender, sexual orientation, age, disability, and lifestyle should be. We should come out of those things. Disability has to be taken care of. Make the world a healthier place for all. Almost 70% of all cancer deaths occur in the least developed parts in the world. And they do not have money to take care of these things because they are struggling to live their own life rather than spending money on getting treated. What is that which can be done? 90% of the low and middle income countries do not have access to radiotherapy. But India being fortunate, we have more number of things when compared to the density which we have. And 5% of the global resources for cancer prevention and control are spent in low middle income countries. This is because there are many more priorities. So don't expect that government or somebody is going to come and help you. It is you who have to help yourself. You have to take care of your own health. No one is going to come and help you. And by 2040, the global demand for cancer chemotherapy is going to increase, and this is going to, and two-thirds of this demand is expected to come from lower income countries. Means cancer cases are going to go up. Inequality is there in our own background. Who you are and where you live can negatively affect the level of cancer care you receive. Fortunately, in the Indian context, we have both national and the state programs which help in cancer patients to get access for treatment, investigations, and all. Barriers to life-saving cancer services can exist for women and men, children and older adults, So low socioeconomic population, rural and remote population. We move on. So every 2 minutes, a woman dies of cervical cancer, and 2 lakh children become maternal orphans by 2020. Became maternal orphans in 2020. So 1 year we had 2 lakh women dying of cancer. So all the children born to them have become orphans due to cervical cancer, and this unfortunately, is preventable. So this can be targeted by taking HPV vaccine before your age of 12 years. So we can save lives if you spend now. Spending almost 1,000 to 2,000 rupees in your age of 10 to 12 years when you take the vaccine is going to prevent many complications which can occur later. So let's eliminate cervical cancer for future generation, because cervical cancer is preventable and you have to protect yourself. Don't expect that the government or somebody is going to come and help you. You have to do it for your own, because in fact it is your own body and it is your own health. On the World Cancer Day, I asked all of you to take a 5K challenge to, because let's change the world. Cancer is a disease that affects everyone, but not everyone gets the care they need. So let's change this. Let's try to bridge the gap in the cancer care. The 5K challenge is given to all of the viewers who can walk, run, cycling, swimming, and hiking, so that they make their voices heard and make their presence known.